Hello friends, welcome to our channel Let Us Talk. I'm Dr. Preeti Lekra and I am a family physician in Florida. Today, I'm going to talk about stroke or CVA, cerebrovascular accident, जिसे हम हिंदी में लकवा मारना भी कहते हैं. Stroke can happen at any time, at any place and to anyone. कभी भी, कहीं भी और किसी को भी हो सकता है. No one is immune. It is one of the leading causes of death worldwide and a cause of long-term adult disability. In the last almost 2 years of the COVID pandemic, we have heard a lot of cases of stroke, and most of these cases were in seniors or elderly. I will not go in details of types of stroke, how is it caused, or how can it be treated, but would like to speak a little bit about how can you prevent stroke and what can you do if anyone around you needs your help or if you need someone's help. Well, a lot of patients at my office sometimes ask me if stroke can be prevented. And my answer is yes, to an extent it can be prevented. But how? Stroke can be prevented by healthy lifestyle. Everyone is aware of healthy lifestyle and I will just summarize it over here. Eat healthy. Include fruits, vegetables, nuts in your diet. Balanced diet with appropriate amount of carbohydrates, proteins, and fat is very important. Get enough sleep, at least 7 to 8 hours a day. Drink enough water, between 2 to 3 liters per day, depending on your weight and your outdoor activity level. Reduce stress in your life. Try to stay happy and stop worrying about things you have no control over or the things you cannot change. Exercise regularly as tolerated depending on your health and your age. Throw away the excuses for not exercising. If you cannot do aerobics or cardio, then you can always walk and do yoga or stretching or any form of light exercise. Keep at least 30 minutes of your life for yourself daily and do something or some form of exercise. Stay away from bad habits like drugs, smoking, and too much of alcohol. More than 2 drinks per day for males and more than 1 drink per day for females is considered unhealthy. No amount of smoking is considered healthy. Life is too precious to be wasted on smoking. And last but not least, see your doctor regularly to keep your blood pressure, cholesterol, and other medical problems under good control. It is also very important to get annual checkups done by your doctor if you are absolutely healthy, which should include your complete physical exam, your routine lab work, especially if you are on any daily prescription medications or over-the-counter medications or any vitamins. And it should also include the discussion and implementation of your preventive healthcare screening, like screening for heart disease, diabetes, osteoporosis, and also the available screening for different types of cancers. It is always better to prevent a disease than to treat it, and to be better safe than sorry in case of your health and your life. Sometimes we think we don't need to see any doctor as we are absolutely fine. And we do take pride in doing so. But believe me, I have seen many patients who didn't have any medical problems and have not been seen by any physician for many years. And when they showed up at my office due to a symptom or any problem, things had already advanced, that they needed aggressive treatment or things had gone irreversible. Please stay on top of your health and do not wait for your doctor to tell you that it is too late, and hoped that you should have been seen earlier. Now, coming back to our main point here about prevention of stroke, I would like to re emphasize that you can prevent it to an extent by keeping your brain and your body happy and healthy. As we have come across an increase in cases of stroke during COVID pandemic, we need to make ourselves very vigilant. Sometimes we or the people around us might experience stroke, and we might delay the care or neglect it by being unaware of what to do in that case. In such case, one has to act fast in recognizing the symptoms and getting medical help. By doing this, a life can be saved and permanent disability can be avoided. So, what symptoms or complaints should make us suspect stroke? Some of the symptoms of stroke are unexplained dizziness, loss of balance, sudden weakness or numbness of one side of the face, weakness or numbness of one or both legs or arms, sudden severe headache, confusion, difficulty in swallowing, speaking, seeing, or even understanding. What should we do when we are having these symptoms, or any family member or a friend or any person around us complains of any of these symptoms? We just have to act fast. F-A-S-T, fast. In fast, F stands for the face. Look at the face of the person and ask the person to smile. In case of stroke, you might notice a droop on one side with asymmetrical smile. A in fast stands for arms. Ask the person to raise both arms. You might see that one arm is drifting downwards or towards the side slowly. S is for speech. Ask the person to repeat a simple sentence after you. You might hear a strange speech which is not usual for that person, or you can also hear some slurriness. And T in the fast is the most important one, and it stands for time. If you see any of the above, please do not waste time. Please do not wait and call ambulance and transfer the person to nearest hospital or stroke center. Even if none of the symptoms are positive, but you still suspect something is wrong or you suspect there might be stroke present, please seek medical advice as soon as possible. Please do not delay in recognizing the symptoms and signs of stroke and getting medical help. Remember, 2 million brain cells die every minute during stroke. Every hour, every minute, and every second counts. When there is a lack of oxygen to the parts of the brain cells die very fast. So faster we act, more are the chances of recovery and less chances of permanent damage or death. To summarize, by being vigilant and informed, you can save yourself and also save someone else's life. Stay alert, live healthy, and keep smiling. Thank you for listening. And please don't forget to like and subscribe the channel. Let us talk for the weekly Wednesdays upcoming videos. Thank you.